The Queensland Government has invested more than $1 billion in health this year. Is it enough? And how can we improve the healthcare system? Let me know. My number is 1300 903 222, or you can text me on 0487 993 222. And one part of our health system that's crying out for more funding is the community mental health sector. Jennifer Black is the CEO of the Queensland Alliance for Mental Health, the peak body representing community mental health organisations. Jennifer, good afternoon. What do community mental health organisations do, and how are they different to what might happen in a hospital?
Oh, thanks, Annie, for having me on today. Well, community-based organisations are not-for-profit organisations in communities all around your area, and they provide really practical skills for people to manage the impacts of mental illness and also help re-establish skills. So they might help people with things like employment, education, leisure, social relationships and connection with their community. So very different to perhaps going to the doctor to see your GP or a psychologist or a psychiatrist. Really practical kind of stuff.
How important are these practical services for early intervention?
Well, they're vital because I think people in communities want to go to a softer landing place than an emergency department or a doctor, somewhere where they can get help when they're initially feeling that they're in distress. And that might be something really practical that helps the situation that they're in. The problem is we know that there's an absolute gap in these sorts of services, and these sorts of services can also help stem the flow into our hospital system, and we're told constantly that that hospital system's under pressure.
Now, you're saying the sector's underfunded. What impact is that having?
Well, I think exactly that all roads either lead to your GP or perhaps to the emergency department when you're in mental distress. And we know that emergency departments are not really good places for people when they're distressed. They're busy, noisy, and not necessarily resourced appropriately to help that person.
Now, recently, a national report has been released looking at the gap in services in each state and territory in Australia. What kind of a picture does that paint for Queensland?
Yeah, so we've been waiting for that report for quite some time, but what that report says that for these kind of supports, which they call psychosocial supports, that about 500,000 Australians are missing out on those services, and over 92,000 of those are Queenslanders. Of course, in Queensland, we've got the geographical issues because every Queenslander should be able to access services in their own community. So I think it needs a different coordinated approach to make sure all Queenslanders can get access to those sorts of services.
So what would you like to see happen now?
Well, we've been calling on all of the parties in the lead up to the election. What we've calculated is required, and it's probably conservative, is an extra $150 million annually to be invested into the sector, and we believe that will help grow those services across the whole of Queensland.
So $150 million for Queensland alone, or is that for national?
For Queensland alone.
Yeah, okay.
They've put some numbers in there about how many hours across the country. It'll be a lot more money than that that's needed.
All right. How hopeful are you of the government coming good with that money? As you said, you're calling on all parties ahead of the election to make this investment. How hopeful are you feeling?
Well, we're always hopeful. Otherwise, we wouldn't do the work that we do.
Yes.
But I think this report is really compelling. And we've known it for a long time. This puts some science around it, and I think they don't have a choice. I think Australians will want the government to respond.
Good to hear from you, Jennifer. Thanks so much for having a chat about this really important issue.
Thank you. Bye.
Thanks so much. Jennifer Black is the CEO of the Queensland Alliance for Mental Health.